Welcome back to Everyday Iowa. Well, there can be a lot of confusion about stem cell therapy, and here to clear things up and dispel the myths are Dr. Sunny Kim and Dr. Kristen Comella from Progressive Rehabilitation Medicine. Thank you both.
Thank you.
Yeah. So one of the myths that a lot of people have is that you use embryonic stem cells for this. Is that true?
Yeah, that's not true. So embryonic stem cells are when the egg and the sperm come together at gestation and eventually form a baby. That is not the kind of cells that we are using. What we use are called adult stem cells. Adult stem cells can be either obtained from yourself, from bone marrow, fat tissue, or from umbilical cord blood at the time of a birth, where mom and baby are happy, healthy, fine, and we can isolate stem cells from that.
Okay. I know another myth that's out there is that this is experimental or unsafe. So what does science actually say about stem cell therapy?
It's very much grounded in science. It's basic pathophysiology. The body heals through the use of mesenchymal stem cells, and these help deploy certain growth factors and cytokines that stimulate your body's natural healing response. Okay. So it's a very natural process that's in all of us.
So there's just, I feel like there's a lot of confusion about, just how unsafe this is, but it is not unsafe at all. This is a very, like you said, a very natural process. But can it cure everything? Is that realistic to think?
Yeah, so the concept of stem cell therapy and regenerative medicine has been around for more than 2 decades. In fact, our team treated its first patient in 2001. So the science is sound. We've demonstrated a variety of miraculous things. And the reason that this works is because the root of all injury and disease is inflammation. And stem cells are designed to reverse or reduce inflammation. So because of that, stem cell applications are very wide. You can use it in so many different indications, ranging from orthopedics to chronic diseases, autoimmune, or congestive heart failure, lung disease, so many different applications where stem cells are being studied, investigated, and demonstrating some good outcomes.
Because I always think it's for like an injury. That's kind of where I went with where this would help, but so there's a lot of different ways that this can help someone. The procedure. Now, this is another one. I don't know if the procedure is like, is it invasive? Is it, just painful? So what does the procedure look like?
So generally speaking, if we're using our own stem cells, our preferred method is liposuction. It's called a mini lipoaspiration procedure. We make a tiny incision about the size of your pinky fingernail, and we extract a small amount of fat, maybe 4 to 8 tablespoons worth. Not enough to be cosmetic, but enough to get enough cells to harvest for the procedure.
Could you do more? People not kidding.
Well, we do get that a lot. I mean, there's multiple different sources of stem cells. You can get it from the umbilical cord, the bone marrow, or the fat, and no one's complaining about getting their fat taken out. A lot of people do complain about having their bone drilled into, though.
Yeah, that doesn't sound pleasant at all. So, another thing, do you have to do this every time you have a treatment, or is it something that you just do once, or how does that work?
Yeah, so we actually have a great technique where once we isolate that fat, we can send those to an FDA-registered tissue bank, and they can be stored for your lifetime. From that one pull, we can get 30 to 60 doses, which is typically enough to last you should you need stem cells in the future.
Yeah, okay, so this isn't something that will, like, expire or...
Correct, yeah, they're preserved in extreme cold temperatures using liquid nitrogen, so it's called cryo storing.
Yeah, okay, so that's another myth, I think, that people think that every time you come in you have to have some invasive procedure done, but that's not the case. Okay. All right, now a lot of people have severe arthritis. I know that I'm developing it, especially the older I get, and then you get told, hey, the only thing that's going to help you is surgery. So is the regenerative therapy something that can help cure arthritis or help with the pain of arthritis?
Yeah, absolutely. So with arthritis, there's not a direct correlation between what we see on imaging and the level of pain that the patient experiences. What the pain that people experience is the inflammation affecting the joints and the nervous system. And MSCs and stem cells are very powerful in reducing that inflammation and helping to repair small injuries for example, cuts and lesions in the bone or cartilage, just enough to give them enough pain relief to stave off the need for surgery.
Okay. Now, a lot of people, I'm sure, have more questions about this. So how could they contact you, and what questions should they ask first when they have pain? So they just come in and just give you a call, or like, what do you kind of need to know from a patient?
You know, because like this is a medical procedure, and we want to understand all aspects of the medical care. So it's important to have a very comprehensive evaluation. So an initial consultation would be needed to review the records. It's always important to get imaging studies and other blood work that might be necessary. You can call for consultation at 319-393-1320. Or reach us at www.prmpractice.com to learn more.
Okay, and this is you want like all medical records. I know sometimes people think, I'm just going to tell them what they need to know for what's hurting me right now, but this is something you need to mention everything. That,
we want to look at everything. We want a comprehensive picture. It's really important to know that.
Okay. All right, so stem cell, it is not embryonic. Right. And the procedure only, you just have to draw those cells out one time and it lasts forever. Okay, that's good to know, because I think a lot of people just think that it's really experimental and unsafe, and it's not. Thank you for clearing those myths up today. Appreciate it.
Thank you
for being here.
Yes.